Thank you and welcome everyone. Good afternoon. My name is Mercedes Switowski. I'm the Executive Director at the New Jersey Council on Developmental Disabilities. Welcome to today's Legislative Disability Caucus session as we focus on recapping the positive impacts this caucus has had and new possibilities to look at for people with disabilities. Closed captioning and sign language interpreters are available, and this session is being recorded. It will be available with all of the previous recordings on the caucus dedicated web page. And you'll see that web page link in the chat in just a moment. You will be able to locate legislators who are caucus members, as well as supporting organizations, sign up for mailings, and submit comments or questions on any topic, including today's topic from that page. Panelists, please remain on mute, and if you're not speaking, that would be great for our audio feed, and attendees, you are in listen-only mode. Let me start by thanking Assembly Majority Leader Greenwald, District 6, for his commitment as co-chair this afternoon for this meeting. I'd also like to thank and welcome the other co-chairs and their staff. For those that couldn't be here, Senate Majority Leader Teresa Ruiz, Senate Republican Leader Bucco, and Assemblywoman Ora Dunn. Thanks also goes out to all Senate and Assembly members of the caucus. I do see Assemblywoman Keano's office staff here, Senators O'Scanlan, Corrado, Senator Shapisi. I'm excited that you're able to join us. Thanks for your staff also who are joining us and might be on the attendee side. At this time, I'd like to do just a quick overview of our meeting. We're hoping that while we look at the policy accomplishments and the areas where the caucus has helped raise awareness, that we also reflect back to our time back from January 2021 when we started. A short time, but so much has been accomplished. We'd like to discuss what's worked and remember that it's people with disabilities and their families really are the drivers of this system. And we hope that we are doing justice in recognizing the phrase that goes, nothing about us without us. So if I can ask legislators and your staff, if as we go through the 14 speakers today, if there's an opportunity for questions, we will certainly pose them at the end, but I'd ask you to just in the chat, make a note of a particular area you want to come back to, and then we'll open up if we have time. We do have 14 speakers today, and they each are being given 3 minutes. So let's see how we do. Assemblyman Greenwald, please, I turn it over to you. Thank you.
Thank you, everyone. Can you hear me? We're good?
We're good.
Okay. Thank you so much. It's great to be back together for our first Disability Caucus meeting of the new year and of the new legislative session. I first want to acknowledge my fellow co-chairs, Assemblywoman Dunn, Senate Majority Leader Ruiz, and newly minted Senate Minority Leader Bucco. Congratulations to all of you. Congratulations, Anthony. Before I turn my priorities to this season, I want to take a moment to reflect on some of our accomplishments from the last season. I think it's always important to look back and acknowledge how far we've come. We were able to get bills signed into law to make workplaces safer for those with seizure disorders, address the shortage of healthcare workers, which disproportionately impacts patients with disabilities, and raise Medicaid rates to keep our pediatric medical daycare centers afloat and now expanding. I know this would not have been possible without the advocacy of the groups in this caucus and the support of our fellow caucus members in a bipartisan fashion. So I thank all of you, and I look forward to hitting the ground running this session. Today, I want to draw your attention to a few of the issues that I'll be focusing on this session, and hope again for support across party lines. The first is the New Jersey's woefully inadequate Medicaid rates, starting with primary care that impacts all families, but certainly families with disabilities. I know many of you have heard me speak about this before, and I'm sure I sound like a broken record, but as someone who works in healthcare in my day job, I have a front row seat to the detrimental impact New Jersey's low rates have had on patients each and every day. 51% of our children in the state of New Jersey, there's 2.1 million children under the age of 21 in New Jersey, 51% of them are on a Medicaid plan. Low Medicaid rates push providers out of our Medicaid network, making it harder and harder for those who rely on Medicaid to find adequate providers to meet their needs. This is especially true for folks with disabilities who need specialized physicians who are trained and have experience caring for someone with their particular disability. That's why in this session, I'm working closely with Chairman Spite to advance legislation that raises our Medicaid rates in the most pressing areas of care. Our children's healthcare outcomes should never be dictated by whether their parents carry a Medicaid card or a commercial card or a self-insured card in their wallet. The second area I'll be focusing on this session is housing for adults with disabilities. Our current housing model, which is intended to integrate disabled individuals into the community, is unfortunately having the opposite effect. The opposite effect with many folks that struggle with disabilities. We frequently hear the concern about the presence of staff and transportation vehicles in this housing. These individuals want to connect with one another, but because of antiquated regulations that prohibit congregate living, these folks are unable to live together in a community setting. Our laws are based on 50-year-old antiquated systems where we looked at congregate living as a way of institutionalized care. Today's models are much more familiar with what we know with aging parents in assisted living or with graduate studying, mixed use available housing, and we're seeing this build all over the country with great success. We also know that the e-blast system of finding providers for individuals on the community care program waiting list remains incredibly slow, and beds often sit vacant for months on end while providers wait for the right individual to fill them. That's why I'm working with the Department of Human Services on legislation to create an online portal for income restricted and special needs housing listings and searches to improve the speed and efficiency of matching disabled individuals seeking housing with providers who have vacancies. Finally, as you'll hear more about this shortly, I'm deeply concerned about the Chapter 23 regulatory changes that are currently being considered by the State Board of Education. This will negatively impact approved private schools for students with disabilities, making it incredibly difficult for those schools to operate and for families that feel secure with the education their children are getting to move forward. I'm going to let John Mulholland go more into the weeds on this, but these schools are vital for the students they serve, and placing undue financial burdens on them in an attempt to cut costs are only going to hurt the ability to educate and cater to the specific needs of their students. I look forward to working with all of you in this session on these and many other issues impacting the lives of our residents with disabilities. We've got a packed agenda today, as you've heard, with many speakers. So without further ado, I will turn this back over to our moderator. And I want to thank everybody for being here. And I'm excited to get started. Thank you, everybody.
Thank you, Assemblyman. You certainly hit a lot of the buttons and really music to our ears in terms of the topics that you've prioritized and the topics that this group has and will be bringing forward today. So I will start as the Executive Director of the New Jersey Council on Developmental Disabilities. We are federally funded and we focus on advocacy, capacity building, and systems change as it relates to people with disabilities and their families. There are 56 councils like the New Jersey Council across all states, and then there are 6 U.S. territories included as well. In New Jersey, the governor names state designated agencies and appoints people with disabilities and families of individuals with disabilities to serve on our council. And the council then is tasked with helping self-advocates and family advocates identify ways in which the services and the systems that they utilize best meet their needs. One example of this was work that we were doing at the council when I came into my position in 2018. The council took the lead in addressing the challenges that students with disabilities face when they're in school and they're involved in school emergency evacuation planning, because oftentimes evacuation planning did not include the needs of students with disabilities. And we heard that at this panel, and we heard that throughout our community. The council held a summit to discuss these school safety issues and the lack of planning, and bills were drafted over the last several years by key members of this disability caucus. And this past month, January 8th, a bill was signed into law requiring certain documentation of the needs of students with disabilities during school safety drills and emergency planning. And further, it requires staff training to prepare the students for what those students need. So the council and other key agencies right now are preparing training for students and families, because oftentimes bills like these are great, but they don't trickle down. They don't trickle down to the people that need them. So as we prepare this training, we will ensure that people have the information that we can get to them to best prepare them for addressing school safety. Since the bill did eliminate some key components that we initially had requested, we'll make sure that that training gets out. Special thanks to members of the caucus for your support in this action, in particular Senators Ruiz, Bucco, Greenstein, Singleton, and Turner, and members of the Assemblywomen Keano, Lampett, Lopez, Murphy, and Spite. We have really embraced this, and now we'll move on to the area of school safety as it relates to transportation for special education students. Next up, I'd like to invite our ombudsman for individuals with intellectual or developmental disabilities and their families, the esteemed Paul Aronson.
Thank you very much, Mercedes, and good afternoon, everybody, senators, assembly members, guests, colleagues. It's great to be here and great to have this opportunity. When we were talking about this meeting and the topic for discussion, Mercedes and I thought, although our office, the Ombudsman's office, predates the Legislative Caucus by a few years, we thought it would be a good opportunity to talk about it, because in my mind and many of our minds, the creation of the Ombudsman's office is an accomplishment of the legislature. It was the idea of it was conceived by legislators. It was formed in 2016 and 2017 by legislators in both parties and in both chambers, determined to give additional resources to families and individuals with developmental disabilities. So I see this as an opportunity to A, to talk a little bit about the office, and B, to thank members of the legislature for making this possible. Again, this office was created by the legislature in December 2017. It was signed into law by Governor Chris Christie in January of 2018, and I was appointed by Governor Murphy to serve as the first ombudsman in April 2018. And the idea for this office was born out of the recognition by a handful of legislators, or probably more than a handful, that while there are a lot of resources in New Jersey for individuals and families with intellectual and developmental disabilities, it's a very difficult, complex, sometimes overwhelming system to navigate. And because we're talking about lifelong disabilities, even when you get through today's challenges, tomorrow often presents another set of challenges. And so the idea was to create an office to provide a resource, an additional resource for individuals and families, to help make sure that they get the services and supports that they need and deserve. The legislation creating our office sort of outlined a set of responsibilities, but we put them into sort of three buckets. First and foremost, we work daily with individuals and families, again, to try to make sure they get the services and supports they need and deserve. Helping them navigate the system of care for people with disabilities, connecting them to the right people, the right offices, and the right resources. Second, we work very closely with individuals and families and our colleagues throughout government to try to improve the system of care for people with disabilities, making it stronger, making it more robust, making it more user-friendly, accessible, and making it more person-centered. And third, and very importantly, what we work daily with individuals and families to try to help make sure that their voice is heard, and their voice is heard in a meaningful way, not just on those issues that directly impact them or their families, but in the larger policy discussions that take place in Trenton. As many of you know, we're a small operation. We're a team of 5 right now, but we're very energetic, very passionate, and very mission driven. And we take a very personal approach to our work. We spend our days on the phone, in video meetings, and whenever possible, in people's living rooms or in schools or workplaces, working one-on-one with individuals and families. And that one-on-one approach really helps us not only to help that individual and family better, but it also informs our understanding of the challenges that individuals and families face. And we, again, try to use that experience and use our, our firsthand knowledge that we get from families to sort of inform the policy discussions that take place. In terms of the Disability Caucus, we're glad to be a founding member and partner in this organization. We think it was long overdue, and we're really grateful to the New Jersey Council on Developmental Disabilities, as well as, of course, the members of the state legislature for making it possible. And I will say, as many of you on this call know, we work with many legislators daily who, reach out to us to help with their constituents. And so we really appreciate that partnership and the support we get. So again, we're glad to be here. We are a product of the legislature, and we definitely think we're a success story. And in that, I will now turn it over to my colleague, Kathy Chin, for the Alliance for the Betterment of Citizens with Disabilities. Kathy?
Thank you. Thank you, Paul. Chairpersons Ruiz, Bucco, Dunn, and Greenwald, members of the New Jersey Legislature, the New Jersey Disability Legislative Caucus, Director Witkowski, and the New Jersey Council on Developmental Disabilities. Thank you for this opportunity to share some of the important work of the caucus. My name is Kathy Chin. I'm the Executive Director of ABCD. The Alliance for the Betterment of Citizens with Disabilities, ABCD, is an alliance of community providers in New Jersey devoted to improving the lives of individuals with intellectual and developmental disabilities. In addition to the provision of day and residential programs and services for adults, our member agencies provide early intervention services, physical, occupational, and speech-language therapies for infants and toddlers 0 to 3 with developmental disabilities and delays. The purpose of these interventions is simply to minimize and prevent permanent disability. As this program is administered by the Department of Health, it was easily overshadowed by hospitals and nursing homes. Because of the many years' effort by the New Jersey Legislature, Administration, Council, and Caucus, and others, for the first time in over a decade and a half, early intervention received a rate increase and continues to receive more attention and resources by the state. Thank you. Resources which we have used to help bolster our workforce of licensed rehabilitation therapists who we compete to employ with hospitals, nursing homes, schools, and clinics. 17,000 infants and toddlers were served last year by the early intervention system in New Jersey, thousands more than in years past. But to the extent the recent audit by the state of New York on their early intervention system is indicative of New Jersey, quote, many children are not receiving services and children who are receiving them aren't always getting them in a timely manner, end quote. We need to double our efforts to improve access, especially in low-income and underserved communities. This from a recent study by the National Institute for Early Education Research at Rutgers Graduate School of Education. In this regard, we are thrilled to be working with the Advocates for Children in New Jersey on their new program, Unlocking Potential Part 2 or UP, the goal of which is that by 2027, 100% of families with children prenatal to age 3 that live in 5 designated historically underserved communities will be connected to resources they want and need, which includes early intervention, so their families can thrive. The human cost to infants and toddlers who do not receive timely and exceptional early intervention services is tremendous. The cost to the public purse, substantial. The commitment to our children and their families must be enduring. Thank you. And I'm pleased to introduce Peg Kinsell of SPAN, Parent Advocacy Network.
Good afternoon, everyone. My name is Peg Kinsell. I am the Policy Director at SPAN Parent Advocacy Network, as well as having the privilege of directing a military family support project at Joint Base supporting military-connected families of children with disabilities and special health care needs. SPAN has a host of projects. Come visit our website. But for today's purposes, we're going to talk about our work with children and youth with disabilities and special health care needs. For the past 35 years, we have been the federally designated Parent Training and Information Center, providing resources, training, technical assistance, and advocacy to families of children with disabilities. And I also am honored to say that we are the Northeast Regional Technical Assistance Center for all the parent centers from Maine to Washington, D.C., including the Virgin Islands and Puerto Rico.
Yeah.
And as a National Parent Center technical assistance, we provide technical assistance to parent centers across the country, 96 parent centers, from Hawaii to Alaska to our own East Coast. So quick commercial, 3 minutes, not a lot of time. What I wanted to discuss for our point of view is that we have a commitment to making sure that school is a safe, nurturing environment. And we firmly believe at SPAN that school shouldn't hurt. It shouldn't hurt physically, it shouldn't hurt emotionally, and it shouldn't hurt from any kind of neglect. We've made some movement on some issues around restraint and seclusion and that use on only students with disabilities. We also kind of hit a bit of brick wall last year because even though seclusion is outlawed in other places, we still have it on the books. And although most of you know that restraint is supposed to be reported to families within a 48-hour window, there is no such requirement for seclusion. So your child with a disability can be kept in a room, prevented from leaving, and you're never even going to know till the trauma impacts them in ways that are too numerous to mention in 3 minutes. Along with that, we do keep a close eye on the disciplinary, the formal and informal removal of students, and have seen a definite tick up since we returned from COVID. So we still have a lot of work to do. Very proud that the legislature passed discipline data that included restraint and seclusion. So this spring we'll finally get a real look at some numbers. But as I said, every student should feel safe and secure walking into their school building and their classroom. And that is a major focus of SPAN's work this year and moving forward. Thank you very much for your time. And I have the pleasure of introducing Tom Bafuto, the Executive Director of the ARC of New Jersey.
Thanks, Peg. Thank you, Chairman Greenwald. Thanks, everybody on the caucus. I'm Tom Bafuto, Executive Director of the ARC of New Jersey. The ARC of New Jersey is a statewide advocacy and service organization for people with intellectual and developmental disabilities and their families. We have chapters in all counties of New Jersey, and we provide information, referral, and advocacy for all areas of a person's life with intellectual and developmental disabilities. And we're celebrating our 75th anniversary this year. We're very excited about that. There were a number of bills we could have highlighted on this caucus call today, but in honor of our beloved Bev Roberts, who we lost this year, I thought I would highlight a bill that was very important to her and very important to the caucus. Basically, for New Jersey families who have New Jersey Family Care and Medicaid and a child with very significant disabilities and medical conditions, there was only one HMO or managed care organization that had the Children's Hospital of Philadelphia in their network. And lo and behold, that MCO dropped it. To keep the care these children received at CHOP was absolutely essential, and it cannot be found anywhere else in the state. The specialists at CHOP are uniquely versed and knowledgeable at serving this population. It was devastating to families and particularly children with complex medical needs. Lo and behold, the members of this caucus stepped up to the plate, introduced Assembly Bill 4688, Senate Bill 3000, sponsored by Assemblyman Benson, Senator Weinberg. The legislation was signed into law in 2021. It was a big victory for Bev, big victory for the entire caucus. The legislation aimed to eliminate barriers to care, especially for children with intellectual and developmental disabilities and complex medical conditions. The bill amended the Medicaid Managed Care Organization contract provisions. The law required the Division of Medical Assistance and Health Services to amend the contracts on network advocacy to require a sufficient number of pediatric primary care physicians and pediatric specialists. The criteria for meeting these requirements included specifics on geographic location, driving time to access doctors, as well as specifics for both urban and non-urban areas. Access to quality health care is critically important to the ARC of New Jersey, clearly critically important to Assemblyman Greenwald and members of this caucus. We were delighted to get that bill introduced, worked through the system, and signed by the governor. And we will continue to work on access to health care for people with intellectual and developmental disabilities. As we move forward, one of the priorities for the ARC of New Jersey is going to be working on our waiting list, which currently there are 2,433 people on a priority wait list. They're waiting 7 to 10 years. That's entirely too long. That's what we're going to be focusing on as we move forward. Thank you. It's now my pleasure to introduce John Mulholland, who is the Executive Director of ASA. John?
Good afternoon, and thank you all for this opportunity. I want to start by thanking Assemblyman Greenwald, Senator Bucco, Senator Ruiz, Senator Gopal, Senator Singleton, Assemblywoman Murphy, and Assemblywoman Dunn for all of their attention, leadership, and advocacy on the issue I'm talking about today. ASA represents over 120 state-approved specialized schools serving over 10,000 students with severe and complex disabilities. I realize that some advocates on the call today would like more students educated in local programs alongside their typical peers. Frankly, so would we. But local districts need our help. With every referral, they are asking us to provide effective services to students that they cannot serve due to lack of expertise, experience, or comprehensive programming. Since COVID, those referrals have increased. Many of our schools are full, not because we lack space, but due to staff shortages. And hundreds of students are now at home with no services at all, waiting. Some of the students we serve will need a lifetime of supports. In fact, the majority of students who benefited from S3434, the extension of special education services to age 22, were in ASA schools. We fought together for them then, and I'm asking for your help today. The State Board of Education is currently considering proposed changes to fiscal code, which would decimate funding for ASA schools and hurt the children we all care about. Few people understand that through these administrative rules, the NJDOE sets our annual tuition based on what they deem to be allowable cost. After years and years of cuts, the rules have reduced many of these allowable costs to levels that make delivering effective special education service nearly impossible. These cuts make it harder for our schools to hire, train, retain staff, and use independent contractors when we are not able to hire, a growing problem with the staff shortage. They make it nearly impossible to hire experienced credentialed specialists. They make it hard to move to a new location. They even make it impossible to start the school year before September 1st, which public schools are allowed to do. Hundreds of messages have gone to the state board, the governor's office, and NJDOE. Scores of parents and school leaders testified on the impact of these cuts. Even a former education commissioner came forward to oppose these proposed changes. You should know that program monitoring of our schools has been overwhelmingly positive. The state is consistently impressed by our outcomes and innovative programs. However, NJDOE's oversight of fiscal operations ignores these excellent outcomes, shows a gross lack of understanding of this work, and disrespects our students. Can you imagine? NJDOE wanted to cap spending on behavior modification for each child at $20 a year. This is 11 cents a day. And they referred to behavior modification reinforcers as trinkets, again showing they do not understand our work. There are so many examples like this. What is especially unfair is that the same rules do not apply to public programs, self-contained or otherwise. We think this move violates IDEA and discriminates against the children who need the most support. In conclusion, I want to express our profound appreciation for the support of our colleagues at the ARC, ABCD, Autism New Jersey, and other advocacy groups. I invite all of you to learn more and join this fight. Feel free to call me directly at 609-475-5214. That's 609-475-5214. Thank you. It is now my honor to introduce Colleen McLaughlin from the Boggs Center on Developmental Disabilities at Robert Wood Johnson Medical Center.
Thanks, John. Hi, everyone, and thanks for being here today and your continued dedication to the disability community of New Jersey. I'm Colleen McLaughlin. I'm the Associate Director of the Boggs Center on Developmental Disabilities at Rutgers Robert Wood Johnson Medical School. The Boggs Center is New Jersey's federally designated University Center for Excellence in Developmental Disabilities and Leadership Education and Neurodevelopmental and Related Disabilities Program, New Jersey LEND. We're part of a national network of UCEDs and LENDs across the country. The Boggs Center's mission is to collaborate with community partners to build capacity across organizations, systems, and communities. We do this through preparing students in interdisciplinary programs, providing community training and technical assistance to people with disabilities, families, and professionals, conducting research, and disseminating information and educational materials. As a valued and reliable resource for New Jerseyans with lived and professional experience in developmental disabilities, the Boggs Center is grateful for the opportunity to collaborate and innovate across our areas of expertise. And we're grateful for the collaboration across the legislature, administration, and the entire disability community. I'd like to highlight the following topics today: effective transition to adulthood and capacity in the adult system, and continued engagement of the disability community. In our collaboration with people and families, it's more and more common than not to hear about falling off the cliff and the complexity with navigating to adult supports and services that will effectively enable emerging adults to fulfill their vision for life. Over the past few years, we are lucky that there's been increased awareness of this need, with more resources being developed and shared. However, people with disabilities and families often still rely on word of mouth and often lack access to clear and consistent information. Growth of cross-systems collaboration with shared messaging will be an asset to helping people navigate the complexity of services and systems. One cannot mention transition to adulthood without noting the need for high quality of services once one reaches this stage of life. The shared vision we are seeing for building capacity across the direct support professional workforce should be commended, but we can't cease this important work. DSPs are essential workers and ambassadors to our communities. They're the backbone of the human services industry, performing an array of complex tasks that support individual health and well-being, personal care, contributions through employment and volunteerism, breaking down stereotypes, and promoting integration in our collective communities. Current salaries for this workforce still do not equate to what is considered a living wage in New Jersey, and the advocacy community continues to push for this workforce to receive a wage that is both aligned with their job responsibilities and will allow them to support a family without needing to work 2 or 3 jobs. Additionally, there is growing recognition this workforce must receive competency-based professional development opportunities, along with effective supervision and mentoring, in order for job stability and career growth to exist. And we're excited to be engaged in a number of initiatives together with many of the partners with us today to move this work forward. Improving the competency and capacity of the DSP workforce should give rise to higher quality service and, in turn, people with disabilities living healthy, safe, engaged, and valued lives in our communities. And with that thought, I'd like to highlight the importance of the voice of people with lived experience. Today, more people with disabilities and their families are likely to share their perspectives and demonstrate self-determination. Their voice is vital to the policies that directly impact people with disabilities and guides our collective work. There's growing recognition that disability is a natural part of the human condition, and that all policies, regardless of subject, disability or not, impact people with disabilities as New Jersey citizens, and it is important that this voice be engaged as such. As this caucus continues to flourish and collaborate, it serves as a great opportunity to engage the disability community, to learn how policies addressing all issues will impact those living with disability, whether it be about telecommunications, transportation, access to healthcare, climate change, or any other number of topics important to all New Jerseyans. Thanks for the opportunity to be a collaborator on this caucus, and we look forward to continuing to educate and engage the disability community in creating lasting change. I'd now like to introduce Suzanne Buchanan from Autism New Jersey.
Thank you, Colleen, Mercedes. Majority Leader, Greenwald, Caucus leadership, and everyone here today. As Colleen said, I'm Suzanne Buchanan from Autism New Jersey. I'll share a very quick overview of what we do, report on the progress on S761, and offer you what we think is a pretty easy legislative ask. So at Autism New Jersey, we run an 804 autism helpline that provides referrals and service navigation assistance to thousands. So we're a resource for all legislators and staff, as well as your constituents. We hold contracts with the Department of Health and the Department of Children and Families to provide technical assistance and training. And we host an annual 2-day conference with approximately 1,400 attendees. That's in October, if anybody wants to join us. We also lead public policy initiatives like Medicaid coverage of autism treatment to reduce systemic barriers for families, for children and families of low income. And as the majority leader said, 51% of the state's children have health insurance under Medicaid, and 10,000 of them are children with profound autism. We were the main advocacy organization that championed the Medicaid coverage of autism treatment, as well as a rate increase for one of the codes. And majority leader and everyone else on the call, we were right there, ready, willing, and able to work with you to see some of the other rates increase as well. In terms of S761, this was enacted in May of last year, and it is the autism notation on a driver's license or other state-issued ID, which was sponsored by Senators Poe and Corrado. I believe I saw Senator Corrado here. Thank you. And Assemblywomen Lopez and Dunn, as well as Assemblyman Giblin. And the statute required that an advocacy organization help advise the process and develop written guidance to advise law enforcement. So we've been incredibly honored to be doing so in collaboration with the Department of Human Services, Motor Vehicle Commission, Office of the Attorney General, New Jersey State Police. And on a related note, we just launched our law enforcement initiative. So at this point, I'm going to hand it over to my colleague, Laura Consul, for the easy legislative ask.
So this is both an accomplishment and an ask. Just to put the bottom line up front, it's about criminal background checks. The bill numbers are A1128 and S2311. So in January 2020, Governor Murphy signed the Applied Behavior Analyst Licensing Act, a bill that we had been championing for 2 years. As you may know, ABA is the standard of care for autism treatment. The law gives the state the legal authority to protect consumers, employers, and state agencies from substandard ABA practices and false claims of competency. And so it established an ABA Board of Examiners, which started meeting in July 2021. They proposed regulations in May 2023. Those regulations are now pending adoption. Autism New Jersey is currently advocating in support of a bill that would require criminal background checks for behavior analysts. Assemblyman DeMayo introduced a bill A1128 that would accomplish this, and Assemblywoman Matsakudis and Assemblywoman Dunn have also signed on. Thank you, Assemblywoman Dunn. I think I saw her here. And Senator Singleton is carrying the bill in the Senate. We think this is just good, sound policy that aligns professional standards with other healthcare industries, and we love to see A1128, S2311 move through the legislature as quickly as possible to ensure its immediate implementation in alignment with the final regulation adoption. And with that, I will turn it over to Tom Grady from the Brain Injury Alliance of New Jersey.
Thank you, Laura, and thank you, Suzanne. Good to see all of you today, and thank you for this opportunity to speak. Some of you do know me, but for those of you who may not, I am Tom Grady. I'm the Director of Advocacy and Public Affairs for the Brain Injury Alliance of New Jersey. We're a statewide nonprofit organization committed to maximizing quality of life for all people impacted by brain injury through information services, advocacy, and support services. We also strive to try and prevent brain injury from happening in the first place. Today, I want to speak in the context of one of our key programs, which is the Community Services Program. And if I don't leave an impression with anything else in this 3-minute talk, I'd like to leave you off with one thing. If you have any constituent that has a brain injury or was impacted by brain injury in some way, shape, or form, please do think about the Alliance in terms of being a resource of potentially helping that person. So with that said, the aforementioned Community Services Program has various components to it. And I do have detailed accomplishments, but we'll be here well beyond the 3-minute mark if I go into all those. But to give you a general idea that we do presentations throughout the state on various topics associated with brain injury. We do education events such as our annual seminar geared for professionals. We have regional seminars, and we have exhibits. We exhibit throughout the entire state. We have 2 programs geared toward families impacted by brain injury. One is called Cares for Kids. Cares for Kids, as the name implies, focuses really on the unique needs of children with brain injury. And then more expansively, we have BIA&J Cares, which takes into account the needs of families impacted by brain injury. If anybody here knows about the impact of brain injury or any disability for that matter, it impacts the entire family. So we try and serve everybody who has their connection to brain injury. And also a very important element of our support services is support groups. We have support groups in most counties in the state of New Jersey. It serves as a resource for anybody to talk about living with brain injury and what they may need and how one can help the other in the world of brain injury. In my particular world, I deal with advocacy and public affairs, which deals with policy issues, government relations, teaching, advocacy skills and tactics to advocates. I distribute a legislative and advocacy roundup each month. I do webinars, but one thing I'd like to point out is that on March 13th at 10 o'clock a.m., we'll be having a virtual brain injury awareness day. Some of you have attended that in the past, and that event is really geared toward raising awareness of brain injury, of the Alliance, and of a certain issue pertaining to brain injury. This year, we will be focusing on the importance of concussion management teams in the high school and junior high school setting. And with that said, you will be seeing a notice sometime soon, probably sometime this week, inviting you all to attend that. So at this point, I can turn it over to Mary Saccone of Disability Rights New Jersey. Take it away, Mary.
Thank you, Tom. Thank you to everyone here today and all for your support of people with disabilities. My name is Mary Saccone. I am the Director of Policy with Disability Rights New Jersey. Disability Rights New Jersey is the designated protection and advocacy system for people with disabilities in the state of New Jersey. As an organization, we have 2 main functions. We have a protection piece, which means we are there to prevent and investigate and monitor and assist people who've been abused and neglected in any facility. As a result, we go out and we monitor and we investigate allegations of abuse and neglect. We also have the advocacy piece, which is we provide for the legal, civil, and human rights. We fight for the legal, civil, and human rights of people with disabilities throughout the state of New Jersey. We are guided by our goals, which one of our key goals is to ensure that people with disabilities have the opportunity to live in the community to the extent that they wish to. And as such, live as people would without disabilities. So they can live with their peers, they can live with whoever they want to live with. One of the things in order to live in the community is making sure that there's proper supports and services for many people with disabilities. One of the key funders for these supports and services is Medicaid. And we want to talk about the legislative policy that was enacted in the past legislative session, presumptive eligibility for Medicaid for HCBS services. One of the key ways to make sure people remain in the community is to make sure they don't go into nursing homes when they have a crisis. In the past, what has always happened is people with disabilities might be living at home, they haven't necessarily needed a lot of supports and services, and they don't necessarily have never gotten eligible for Medicaid because they haven't needed those services. They have a crisis, they go to the hospital, and the hospital stabilizes them and they're ready to discharge them. But they need now they need supports and services. Since they haven't gained eligibility for Medicaid before, they now have to go through the Medicaid approval process, eligibility process. That can take up to three months at a minimum. And as a result, they may need supports and services to return home, but they have no way to pay for that. But with the new presumptive eligibility, as a result, they would have to go to the nursing home. With the new presumptive eligibility, if they appear to be eligible for services, doing a quick calculation, then they can immediately get the supports and services from HCBS providers immediately and can return home at where they want to be, rather than going into a nursing home, where if they would go into a nursing home, they would be likely to remain there for an extended period of time, if not for the rest of their lives. So this is one way to make sure that people don't go into nursing homes and that they can continue to remain in the community as where they feel comfortable, where they have family, friends, social structure, and can live their lives how they want to live them. So I would like to thank the legislators for this important bill. Now I'm pleased to introduce Deborah Wentz from the New Jersey Association of Mental Health and Addiction Agencies. Thank you.
Thank you. Good afternoon, and I thank all the members of the Disabilities Caucus for your time and dedication to the issues facing vulnerable populations. I'm President and CEO of the New Jersey Association of Mental Health and Addiction Agencies, or NJAMA. NJAMA represents 164 organizational providers of mental health, substance use, and co-occurring services who provide services to over 500,000 children, youth, and adults each year. We've been in existence since 1951. We're very grateful to this caucus for its many achievements that support both providers and those they serve. The bills I mentioned have all been signed into law and are all having positive impacts on access to care for individuals with a mental illness or substance use and/or a dual diagnosis with an intellectual or developmental disability. Of great importance is the telehealth bill S-2559-A-4179 from December 2021. This bill made permanent changes to earlier statutes, allowing both the provider and client to be in any location to deliver or receive services. Until this change, the requirements to be in a licensed facility had kept telehealth as a rare option for accessing services. The updated law also allows for audio-only services for behavioral health care. In the 2022-2023 session, many bills were moved and signed into law to improve access to care. Among them, I want to highlight A-4755 and S-3261, permitting behavioral health services in homeless shelters. Also, A-1255 S-1794, requiring new standards and more transparency in the pre-authorization process, and S-311-A-2036, establishing the critical and growing 988 crisis response system. The 988 crisis response system began with just enhanced and expanded call centers connected to the national 3-digit number. Recently, 62 contracts for mobile crisis teams were awarded across the state, with services to start on March 1st. This will bring services to people when and where they need them most and help avoid not only emergency room visits and hospitalizations, but police involvement as well. So we look forward to continuing to work with you to improve access to behavioral health care for all New Jerseyans who seek it. Thank you. And next, I would like to introduce my colleague, Diane Riley, who is Executive Director of the Supportive Housing Association of New Jersey. Thank you.
Thank you, Deb, and good afternoon. The Supportive Housing Association of New Jersey, I'm proud to say, is in its 25th year, and we're a trade association nonprofit statewide. We represent 110 organizations dedicated to the efforts to create permanent, affordable, safe housing with flexible services for people with disabilities or special needs. Having said that, we span silos. We span people who serve many different clients, people with mental health, people with or facing mental health challenges, addiction challenges, people with intellectual or developmental disabilities, physical disabilities, those that are aging, those that have faced homelessness, and more. Now, having said that, I will say they all have something in common, and that is to lead independent and full lives. They need safe, affordable housing in order to do that. And they need to do that living in communities throughout the state. So I'm happy to call my colleagues, my colleagues' supporters, and we work together to improve lives. And thank you to all of the Disability Caucus members. We span silos, and that means working with our state departments, working with the Department of Community Affairs, working with the Department of Human Services, and all of the divisions under them, the Division of Developmental Disabilities, Mental Health and Addiction Services, New Jersey Medicaid, and both sides of our legislative aisle. Having said all of that, I would say the most important social determinant of health, if I had to pick one, is housing. And so this is a critical need. We currently have 230,000, a 230,000 unit gap of affordable housing. And we have been making great strides in our great state to fill that gap. I want to say one thing. We have something that almost no other state has, and that is a framework called the Mount Laurel Doctrine. And that says that every town has an obligation to provide their fair share of the region's need for affordable housing. And that is why you've seen so much great development going on, especially in the last 8 years. I do want to focus on the last 8 years. So overall of the 43 years, we've created 72,000 homes. But over the last 8 years, we've produced over 20,000 homes, which provides 50,000 people with the affordable homes they need. That's incredible. And that's not an accident. It's because we've worked through the kinks, we've worked through the processes, we've broken through the arguments, and we are now on a trajectory to increase the affordable units available to our state. And we have an opportunity right now to continue that momentum. It's very important we don't take 3 steps back when we've taken so many steps forward. Right now, there is legislation before you, S50, and we've had legislation A4, which would create improvements to the process we have now to continue to build affordable housing. And that means to continue to build supportive housing. The A4 has already, with your support, many caucus members' support, passed the full assembly, and we are now poised to continue moving S50 forward. I want to review a few things about this bill that makes it so important. One is it codifies the methodology of who needs affordable housing and the methodology of what the town's obligations should be. And that's been worked through the courts. And this would codify that methodology. This is important because I will tell you that when I started in the Supportive Housing Association, the courts were still arguing about whether or not to count people with extremely low incomes in that prospective need. Now, that is every client that we all support. So they were basically proposing not to count them as needing housing. And luckily, that horrible notion has been dispelled and put to bed by the courts. We want to continue codifying that important step forward so that this legislation will do that. It also outlines bonus credits that have been very important to supportive housing. Supportive housing currently enjoys a 2-to-1 bonus credits in building affordable housing. That's important because it's incredibly hard to build, and most towns really would prefer not to have special needs housing in their towns. So it is important to incentivize supportive housing in the building. And it does that. It continues that momentum in creating supportive housing incentives. So that's very important. It also strengthens the funding and construction transparency. Right now, it's almost impossible to find out what municipal trust funds are available in each town. This would actually require reporting and transparency in terms of the town's affordable housing trust funds and funding available to build affordable housing. So these are some of the important things that this bill does. I hope, and each one of you will get an email from me to support S50 as it moves. It needs to right now be presented to the Budget and Appropriations Committee and then on to the full vote in order for the governor to sign this. So this is a once in a lifetime chance to move affordable supportive housing forward. So I thank you. And now I'd like to introduce the Val Sellers from the New Jersey Association of Community Providers.
Thank you, Diane. And I'll preface it by saying I'm your last speaker before we turn this back to Mercedes. And thank you. I am Val Sellers, CEO of the New Jersey Association of Community Providers. We represent 67 provider agencies throughout the state of New Jersey. And I have the pleasure of talking to you about our workforce, our direct support professional workforce. As you may recall, the legislature has been supportive of increasing DSP wages for the past 5 years with the objective of ensuring that DSP wages would be greater than the minimum wage by $1.25. And that has been the case for the last 5 years. And for that, we thank you. Serving as a direct support professional is by no means a minimum wage job. It's challenging and often underappreciated given the level of responsibility and the challenges that may be encountered in serving this community. If not for DSPs, you would not see individuals with intellectual and developmental disabilities leading rich and fulfilling lives in our communities. Following the pandemic and even today, agencies are experiencing staffing shortages as they are competing with retail, the food industry, hospitality, among others, which are paying as much as $24 per hour. We recognize that absent continued funding from the state, it will not be easy for providers to continue to raise wages. However, there's still an overwhelming need for DSPs. Excuse me. In an effort to attract people to the field of direct support, S4102 was signed into law on January 22nd, 2022, and championed by then Senator Sweeney. Its objective was to find creative solutions to the long-standing shortage of DSPs in our state. To accomplish this goal, a pilot has been established that allows for a DSP career development program funded through the Secretary of Higher Education. This program is a collaboration with the Secretary of Higher Ed, the Council of Community Colleges, and NJACP. It includes both Bergen Community College and Rowan College of South Jersey. The colleges, along with NJACP, are recruiting at local high schools, in addition to county workforce development offices, FQHCs, faith-based organizations, among other sites, to draw people into the field that many did not even know existed. Those new to the field may pursue an internship and training that allows firsthand experience working with individuals with IDD and provides the opportunity to work alongside experienced direct support professionals. A stipend is provided and students can check with their guidance counselors to determine if work will translate into high school credit. The other part of the program involves existing DSPs. Most DSPs would qualify for free tuition at any of our state's community colleges, and we're working to reach as many DSPs as possible to make them aware of the option to pursue certification in a specific field or pursue an academic degree. A DSP mentoring program is being established that will provide assistance and support to DSPs as they try to juggle work, home, and school. As funding was not distributed until 2023, the program has been functioning for a little less than a year, and we've already graduated 30 new DSPs and have 7 existing DSPs that have reached out to explore pursuing a degree. Funding is set to expire at the end of this August. However, we are hoping that the Secretary of Higher Education would consider funding it for at least one more year, as there needs to be sufficient time to determine if this is a model that will help with the recruitment and retention of DSPs. Until providers are able to pay a truly competitive wage and thereby reduce turnover, we have to explore other ways in which we can draw people to our community. And this may be one effective tool to do so. And I thank you on behalf of the community colleges for your support for this legislation, and hope that we have another year to see if it's an effective tool that we can use to address the workforce crisis. And Mercedes, I'll turn it back to you.
Thanks, Val. It's an honor and privilege to really work with this panel and to have members of the Senate and Assembly here today. I think this was one of the most successful speed dating rounds that I can recall. We really got through a lot of territory, and I know that we're at the top of the hour, so I'm going to ask Assemblyman Greenwald to please bring us to close here.
Well, thank you, everyone. I know it's difficult. There's a lot to communicate in 3 minutes. It's very important. I can't thank you all enough for so many of you taking time out of your day to be on this call. I know this is a passion as much as it is a job for everybody here, and it means a lot to us. I think what was good about today, kind of kicking off the new session, is we hear a lot of commonality about the problems we have to address, and I don't think there's any pride of authorship and what it looks like. I think it's the beginning of a process to make sure that we start to hit some of these targets and really address the needs. And if we're as successful as we were last year, where we can start to knock off a number of these initiatives, we continue to build upon a process that creates equality and access to the American dream for everybody. So thank you all for doing this. Mercedes, thank you to you and your team, and we look forward to the next session.
Thanks, Assemblyman. So we'll see you on April 23rd for our next session of 1 hour session. Please go back to the recording. I really encourage anyone listening today to reach out to these members, the panelists who spoke. If you heard something in particular to follow up on, we encourage that you take the opportunity to have a conversation. All are willing and ready to have those conversations with you. So thank you all. Have a great rest of your day.